Is it possible if you take enough vitamins, and there are pills out there that can keep you young forever? What essentially is the point that you're making here? That there are on the shelf around the world, absent a meddling FDA, I'm sure you would allege, many companies in other countries that are sharing with their customers material which enhances life, which makes you feel younger and makes you live longer. Do I understand your position?
Medicines available in other countries are 5 to 30 years ahead of United States medicine, depending on which classification of drug you look at.
Right.
And as a result, Americans are the last to get the benefits of these breakthrough medications. They pay the highest prices in the world for their prescription drugs.
Talking about living forever, or certainly for a long time. My next guest is the Vice President of the Life Extension Foundation. Will you please welcome William Falloon, right? Now, again, another philosophy very close to what we just listened to is your philosophy, which is treat yourself well, think right, and you'll extend your life.
Well, that's correct. We believe in biological intervention into the aging process. Because of the criminal FDA. That is why we can't get information about drugs used in Europe and Japan that slow down aging. We have a corrupt FDA who is in the pockets. The pharmaceutical industry makes lots of money treating the diseases of aging. They make money when people get sick. We're talking about preventative medicine here.
We have some more really interesting information to share with you from a person we're glad to have with us again, a repeat guest. Bill Falloon's going to be talking to us in just a moment. And now, as we said, we're continuing our discussion of alternative ways to improve the quality of our lives and prevent illness as well. There's a place called the Life Extension Foundation, LEF it's called. It's based down in Hollywood, Florida, and it's all about discovering and promoting non-conventional ways to combat cancer and heart disease and the diseases of aging. Bill Falloon is the Vice President of LEF. And as we always say, you always should consult your doctor and let him know you're trying these things as well. It never hurts to do, but Bill Falloon always has interesting information for us from the Life Extension Foundation.
Two precious rights in this democracy are the right to know and freedom of choice. Our guests are Mr. William Falloon. Mr. Falloon is Vice President of the Life Extension Foundation. Our other guest is Mr. Tony Martinez. Mr. Martinez is the Nutritional Health Alliance's Legislative Affairs Liaison in Congress. I have to say that the mystery seat is for the promised member of the Federal Drug Administration, the FDA, who called at the last moment and canceled and said he was ill and could not come. The FDA then referred us to 5 other organizations that they said opposed the positions of you two gentlemen. Not one person at either of those 5 organizations would accept the invitation to come. So it appears that the people who disagree with you don't want to be around you. Am I missing something here? Are you having difficulty carrying on this debate?
How many Americans die every single year because of the U.S. Food and Drug Administration? My name is Bill Falloon. I'm Vice President of the Life Extension Foundation, and we have documented more than 70 years of atrocities committed against the health of the American public by the incompetent and corrupt Food and Drug Administration. We're entering the FDA Holocaust Museum. We call it a Holocaust Museum because we have substantiated that the FDA has caused the suffering and death of millions of American citizens every single year.
The FDA has a track record of approving dangerous drugs that kill Americans. In fact, we've documented about 125,000 Americans die every single year because of FDA-approved drugs that kill. And that's why when people say, well, we need the FDA to protect us, we can expose the truth here. The fact is the FDA does not protect us against dangerous drugs. Now, I think everyone is familiar with cancer chemotherapy drugs. What we have here are a number of familiar names to any family member of a cancer patient: 5-fluorouracil, adriamycin, methotrexate. These are lethal drugs that kill cancer patients, that wipe out immune function. And for 80% of people who have cancer, they don't need to be taking these types of toxic medications. And yet the FDA approves and encourages these types of drugs to be used. And that's why the mortality rate for cancer is so high. But it's not just the chemotherapy drugs that kill Americans. It's the non-steroidal anti-inflammatory drugs prescribed for people with chronic arthritis pain and any kind of chronic inflammation. About 7,000 Americans die every single year from this one class of drug alone. 7,000 Americans because of non-steroidal anti-inflammatory drugs like Voltaren, like endomycin, like a number of drugs that you think are safe. They're only going to relieve pain and inflammation, and they make the problem worse. So we've tried to expose as many examples here of drugs that the FDA says are safe, but really kill a lot of Americans.
Product you probably have in your medicine cabinet right now, Tylenol, or its main ingredient, acetaminophen, a pain reliever that everyone agrees is very safe when used properly. Millions of people take it to relieve headaches, muscle aches, even hangovers. There's something important that you may not know about Tylenol. As Chief Correspondent Chris Wallace found out, when acetaminophen is taken by people who drink alcohol regularly, there can be disastrous results.
People could be in danger from taking moderate amounts of acetaminophen and alcohol, not overdoses. But the makers of Tylenol resisted, warning the public. In 1976, an unidentified 59-year-old woman died, according to records, from acute alcoholism and Tylenol. The next 10 years, 13 studies were published, reporting 19 cases of liver injuries, including 5 deaths, from alcohol and acetaminophen. But the company kept insisting. Each victim was an alcoholic who took a huge overdose of Tylenol.
Do you have any information on what happened to him between the...
In 1986, Dr. Hyman Zimmerman, a world-famous liver expert, published a study which contradicted the company's position, that it took an overdose of Tylenol to hurt alcoholics.
We found that there were patients who had taken doses that were not in the toxic range.
So people that were taking at or near the recommended dosage were still getting serious liver damage.
Yes, absolutely.
Zimmerman's study worried the company. An internal memo obtained by Primetime shows McNeil feared another attempt by the FDA to force the company to put a warning on Tylenol. Labeling could impact Tylenol's safety image, and had spent years studying acetaminophen poisoning, and had concluded it threatened many more people than generally thought.
It looks like a normal biopsy.
He had compiled 161 cases of serious liver damage, including 31 deaths, over the previous 16 years. He says 40% of his cases had taken no more than the recommended dose. That's 8 extra-strength Tylenols a day. And he says 35% of the victims normally had 3 or fewer drinks a day containing alcohol. Barbarino, a Philadelphia housewife who says she normally drinks 3 or 4 beers a day, got the flu in 1990. Her doctor recommended she take extra-strength Tylenol. 2 days later, she was in an intensive care unit with liver failure. Now she's suing the makers of Tylenol. In 1993, Russell Domke, who drank about a 6-pack of beer a day, got the flu. A 39-year-old father of 2 who owned a Florida landscaping company, he took Tylenol to treat his illness. By the 3rd day, he was disoriented. His ex-wife, Rose, rushed him to the hospital. cause of death was listed as due to the toxic effect of acetaminophen, or Tylenol.
Do you have to be an alcoholic to be at risk here?
I don't think so, no.
Do you have to have exceeded the recommended dosage of Tylenol to be at risk here?
No, sir, you do not.
Zimmerman says it's like a lightning strike. For some unknown reason, some people are more vulnerable to the mix of alcohol and acetaminophen than others.
Hailed as the wonder drug for anxiety and panic attacks, Xanax, also known as alprazolam, is a powerful psychiatric drug that came on the market in 1981. Stronger and faster acting, it soon replaced Valium as the #1 selling tranquilizer in America. Over 22 million prescriptions were filled just last year alone. But there's another side to this so-called wonder drug, a side that the millions who turn to it, desperate for help, may not have been aware of.
I think there was a tremendous failure to perceive the potential danger of this drug.
Dr. John Steinberg is an addictions medicine specialist at the University of Maryland.
The worst thing about this drug was a failure to perceive how difficult it would be to stop, how intensely people would be attracted to it.
People can become habituated to it, become tolerant to it, so it takes more and more drug to produce the same effect.
Dr. Solomon Snyder directs the Department of Neuroscience as a professor of psychiatry and pharmacology at Johns Hopkins University.
Patients should be told that this is a addictive drug and they must be careful not to keep taking it and not to increase the dose.
How did this happen? Well, early clinical testing of Xanax never went beyond an 8-week trial period. So no one knew what a broad range of potential side effects this drug could have.
Were all of these cases simply odd adverse reactions to this popular drug? To find out, 2020 conducted an investigation of over 65 hospitals and drug rehab centers around the country, asking about their experiences with Xanax. None of the facilities were surprised we were inquiring about problems with Xanax. They had seen them before. Nearly 90% reported seeing patients with similar symptoms to the ones we'd been hearing about: addiction, depression, hallucination, seizures, suicidal tendencies, and even in some cases, homicidal tendencies.
And many noted that withdrawal from Xanax can be tougher and more dangerous than kicking heroin. These and other symptoms were apparent to the agency in charge of overseeing drugs for many years. The FDA in 1989 estimated that 60 incidents of extreme violence in that year could be linked to Xanax. Federal emergency room data show reactions to Xanax in combination with other substances accounts for nearly 8,000 emergency room visits a year.
Awfully important to know both of these things. Thank you, Tom.
Bill O'Reilly, thanks for watching Inside Edition today. Likes to experience pain, and for those who have chronic pain, it can be unbearable. Enter the pain patch. But Inside Edition has been investigating, and as Matt Mahar reports, the patch does relieve pain, but it also has killed.
Inside Edition has learned that Chris Tyson was not the only person to die of an overdose while wearing the Duragesic pain patch. In fact, the first death occurred just 4 months after it hit the market in 1991. Many other patients have suffered serious, sometimes life-threatening side effects. Our investigation reveals a series of failures that led to the drug being prescribed for the wrong types of patients, even though it had been predicted it might kill them. Fingers are now being pointed in all directions, but we've learned that the companies and the FDA knew years ago that the pain patch could be deadly for some patients. Dr. Stephen Jackson says he told them. He was commissioned by the manufacturer to help test the drug.
The alarm systems were going off on all of our monitors, and I didn't believe it, frankly, at first, that my patients wouldn't be breathing over a period of 90 seconds. They just would stop breathing. And
that's pretty serious,
isn't it? That's very serious.
Dr. Jackson says he refused to continue the study because the patches were overdosing his patients.
I was afraid that I was going to significantly injure or even kill a patient, and I refused to be involved with that.
Dr. Jackson was not alone. An FDA review found overdoses in most every study submitted by the manufacturer, saying on average, patients received 150% of the target dose, and warning that this excessive release of fentanyl can have significant safety consequences. The FDA to sit down and answer some questions for us on camera, but they repeatedly refused.
Maybe one of the reasons they didn't want to talk to us on camera is because we know that their own review process back in 1990 predicted that the pain patch would be inappropriately prescribed, and they went ahead and approved it anyway.
Now, the General Accounting Office published a report in 1990 on post-approval risks of drugs that the FDA said were safe and effective. Now, that time period extended from 1976 to 1985, and what they found is that 61% of the drugs that the FDA approved had serious adverse reactions that caused these drugs to be removed from the market, relabeled with all kind of cautions, or even had to be recalled on an emergency basis. That's out of 198 new drugs the FDA approved, 102 of them had serious post-approval risks. So when people think the FDA is protecting us against dangerous and ineffective nutrients and drugs, they're not doing that. They're approving very dangerous drugs. People are dying from these drugs, and then the drugs get slowly withdrawn from the market if there's enough pressure put on the FDA. In many cases, and we've documented it here, the same drugs that were killing people years ago are still being sold. The non-steroidal anti-inflammatory drugs, the cancer chemotherapy drugs, these drugs remain on the market, sometimes with a little bit more caution attached to them, but the FDA allows Americans to suffer and die from dangerous products. The FDA is not protecting Americans.
You, in fact, from AMA data, have reason to know that we lose an extra 100 to 150,000 people a year from the adverse consequences of medications. With regard to supplements, the evidence of safety, both at the molecular level, at the clinical level, at the experience level, because as we said, there are over 100 million Americans who are now taking supplements with some regularity, and many millions of those people taking supplemental doses, that is what is necessary for their body's chemistry to work at its highest level and most efficient way. This provides really abundant information in the marketplace, in the laboratory, in the clinical experience of those who will look at it about the safety of supplements.
The FDA suppresses the truth about life-saving medications and nutrients.
Utah Senator Orrin Hatch, who represents, by the way, one of the healthiest states in the nation.
Well, the problem is the FDA's had an antagonism towards dietary supplements for 31 years. They've really tried to make them prescription drugs, and they'll deny this, but the fact is, if you disagree with their recommended daily allowances, and many nutritionists, many doctors disagree, so what they want to do is basically come in, treat the American people like we're a bunch of dunces, like we're too stupid to make our own decisions at a time when all kinds of scientific journals and others are saying that dietary supplements help us with disease prevention and health promotion, and at a time and make them really subject to FDA regulation so that the costs go up, the substances, the dietary supplements and nutritional supplements become less available, and of course millions of people have less care.
But Mike, all Mike is saying is he wants to say that if vitamin B23 says your skin, the skin disease you have will go away, it should go away.
Well, here's the problem with that. The FDA, let me give you a good illustration, folic acid. For 11 years now, the FDA has known, and there has been evidence that folic acid will prevent neural tube defects. We have around 1,200 babies a year, every year, that are suffering from neural tube defects that could and probably would have been prevented had the claim been allowed that 0.4 milligrams a day, 0.4 milligrams a day of folic acid should be used during pregnancy. Even 2 years ago, the Centers for Disease Control said, come on, FDA, let's do something about it. Let me just give you an illustration here. These are the regulations that finally the FDA came up with on folic acid, and they still haven't approved that claim, and we still have 100 babies a year, or a month, excuse me, 1,200 a year.
Folic acid in the health food?
Sure, you can, but nobody can make the claim, and a lot of mothers aren't getting the help that they need. And that's the problem. You can't get it through the FDA. They won't approve.
How about that, Mike? Every
costs
day
go up. It's unbelievable.
Learned that vitamin E increase, vitamin C, multiples. If you had your way, these wouldn't be claimed that way.
No, that's not the case. It was
Well, sure
really
it is.
just 3 years ago that Congress passed a law that made it possible for us to evaluate and approve these health claims, disease claims for nutrients. We've done that for about 8 different nutrient disease relationships, including last week we published a proposed regulation to approve a folic acid claim.
Yeah, after 11 years. After 11 years of ignoring it and ignoring the problem.
I just need to correct the record with respect to the science here. It's been known for some time that very high levels of folic acid, the kind you could get in a prescription form of this substance, way above the amount you could get in the diet, had this benefit. It's really been just in the last couple of years that we've begun to get data from studies in Europe actually showing that lower levels of folic have the benefit. And it was just last year that the Public Health Service, including FDA, stood up and said to the American people, the kinds of levels you can get in the diet, about 400 micrograms, will have this benefit.
All right, is folic acid dangerous to you?
Folic acid folic acid is a very interesting example of what we deal with when we consider these health claims. At one level, about 400 micrograms, it's very beneficial, indeed it's essential. At just 1,000 micrograms, there begins to be a concern about safety, about masking pernicious anemia. So if you get too much folic acid, you could miss possible
Or you're
serious...
saying you could overhealth. You could take too much vitamins,
like
too much.
Every substance we are exposed to in the environment or in our diets, a little bit is fine, too much, there's always too much.
All they have to do is allow the claims to be made and say that 0.4 milligrams of, or micrograms of folic acid will help prevent neural tube defects, spina bifida. Why have 1,200 kids a year suffer from this when they could have known that? And if there is a toxicity level, then tell us and let us make the claims. But the problem is that the dietary supplement industry is way ahead of the FDA. They've known this for a long time, and they do a very good job.
Was born in 1984 with spina bifida, the most common serious birth defect. It can cause a range of problems, as severe as total paralysis.
I think that what went wrong in my pregnancy is the folic acid counts were low.
Experts now agree on the importance during pregnancy of folic acid, a common vitamin.
After review of the evidence, it seems clear that folic acid will reduce the number of cases of spina bifida and anencephaly, two very serious and common birth defects.
In today's recommendation, the Centers for Disease Control said all women of childbearing age, not just pregnant women, should be getting 0.4 milligrams of folic acid a day.
One must have adequate amount of folic acid before one gets pregnant, and that's why the recommendation is for all women of reproductive age who could get pregnant.
People get folic acid by eating certain green vegetables. It is also sold as a food supplement and in multivitamin preparations. Sufficient folic acid could prevent thousands of serious birth defects a year.
The quandary we're in at the Food and Drug Administration is how to make folic acid available to women of childbearing age, but not put it in excessive amounts in the food supply for other populations such as teenage boys or elderly people.
The FDA has no answer to that quandary yet.
A conference in front of the pharmaceutical manufacturers, an FDA deputy commissioner said something that pretty much exposes everything that we have been attempting to expose through the FDA Holocaust Museum as it relates to dietary supplements, as it relates to the natural nutrients that people can take to reduce the risk of disease. And what this FDA individual said, and it's quite amazing, is the FDA wants to ensure, this is a quote, they want to ensure that the existence of dietary supplements on the market does not act as a disincentive for drug development. And what they're saying is that they don't want people to derive health benefits from nutrients that would then mean that they won't need these dangerous and expensive prescription drugs that these pharmaceutical manufacturers all profit off of. So the FDA wanted to ensure and assure that the
environment for the need for cancer chemotherapy drugs and cardiac medications and non-steroidal anti-inflammatory drugs would remain very friendly to companies so they could continue researching new ways of intoxifying the American public with these dangerous drugs, and for the manufacturers not to have to worry that the vitamin companies were going to make people too healthy and as a result act as a disincentive for the companies to develop their high-priced drugs.
Peter Hudd, currently a law partner at Covington and Burling, was chief counsel for FDA before going to the private practice of law. This year, at a meeting at which FDA senior officials and food industry leaders were present, he said from the rostrum that FDA has been intentionally perverting the intention and the will of Congress with regard to health benefits information for foods, and that he, for one, was not going to put up with it anymore.
It's not consensus, it's not unanimity. You just need a practical agreement among scientists.
Yeah, and Mike is talking about drug claims, and let me tell you something. 8 out of 10 doctors take vitamin E to this very day because they know that it prevents heart disease, that it helps, and the FDA won't allow the claim to be made. Now, if they won't allow something to be made that's that clear-cut, that has appeared in the New England Journal of Medicine, Harvard University, how are we going to get other things?
Why would the FDA want to not prevent people from having a pill that
Well, you tell me, but the fact is they won't allow that, just like folic acid. 11 years now, we still haven't been able to make the claim.
Can these pills give you longer life, prevent cancer, and heart disease? Millions of Americans think they can. They're spending millions of dollars on antioxidants, vitamins E, C, and beta-carotene. Do doctors think they really work?
You know, this is the first time that I've been convinced that there might be some benefit in taking vitamins.
Despite this caution from some researchers, there has been a kind of revolution in the way typically conservative medical leaders think about antioxidants. For example, 2020 recently polled the key medical advisors for both the American Heart Association and the American Cancer Society to see if they take antioxidants. 8 out of the 20 said they did. Even more amazing is the turnaround amongst practicing physicians. Last year, Medical Tribune, a newspaper for physicians, did a poll and found out that 8 out of 10 physicians are now taking vitamin E.
One of the critical issues here is about the benefits that can be attributed to certain natural substances or essential factors. And FDA is saying that they would like to be the clearinghouse. They would like to make the judgments about this information. Yet until very recently, FDA had not found any essential factor to have any noteworthy health benefit. And FDA very clearly says that they will know the truth when they see it, and only their consensus, their internal consensus, will be sufficient for health benefit statement, not the scientific community at large. For example, we have abundant information that fiber in the diet reduces the risk of cancer. My hunch is that everybody in this room has heard that. But FDA does not recognize that abundant scientific information. Antioxidants are also substantially helpful for many forms of cancer, both reducing the risk and in the management, in the overall management of cancer. And yet FDA isn't close to recognizing that benefit. With regard to heart disease, for men, 500 milligrams of vitamin C a day, which is about 10 times the RDA, but not as high as many people take each day. For men, 500 milligrams of vitamin C a day was associated with 5 years more life with regard to their heart disease risk. There's no drug that I can prescribe in this country that can provide an extra 2 years of life for people at risk, let alone an extra 5 years. So there is substantial information that we think should be available to people because of the safety, so that they can make informed choices. And we believe that you should not rely upon a regulatory agency to reach scientific consensus information. That really should be left to the learned society and to the informed public.
Want to cut your risk of cancer? We'll tell you which vitamins may help when Primetime continues.
All those headlines. It seems every week there's a new study pointing to evidence that vitamins might prevent heart disease and certain cancers. In July, the New England Journal of Medicine published a study linking vitamin A to a reduction in the risk of breast cancer. Other studies suggest a lack of vitamin D could be connected to colon, breast, or prostate cancer, folic acid and B12 to lung cancer, vitamin C to mouth, throat, or stomach cancer. Could it be that prevention of some of the most dread diseases starts right here at our local health food store? Dr. Charles Simone, a cancer specialist, is the author of Cancer and Nutrition, a guide to reducing the risk of cancer. Can vitamins help to prevent cancer?
There's no question about that. There's a lot of data now for that.
How do they work? Fatty foods, smoking, alcohol consumption, and environmental factors all contribute to the production of free radicals, chemicals produced in our bodies that can cause cancer. Studies show nutrients like beta-carotene, vitamin E, vitamin C, and selenium act as antioxidants or free radical fighters and may increase immunity against a host of chronic diseases, including cancers.
Mother Nature knew about the free radicals, and she gave us some natural protectors. What she did not count on, however, was that we were going to start abusing ourselves, especially after World War II. We became more affluent, more fatty foods, more smoking, more alcohol, and we saw the rise of cancer go up steeply after that period of time. Insecticides, herbicides, processing, freezing, thawing, trucking around the country, and further cooking really depletes at every stage of the game the level of nutrients in that food. So I think what we thought was before, that is there was a certain level of vitamin C in a fruit, is now not the case.
Research shows because of environmental and lifestyle factors, many Americans could have vitamin deficiencies. Women on birth control pills might be low on beta-carotene, folate, and vitamin B6. If you exercise a lot, or if you're under stress, you could be deficient in the B vitamins. Vegetarians might be low on B12 and D.
I think we will see that miracle cure that people have been searching for. There is no magic bullet, unhappily. Vitamins alone can't have a real impact on anything. It's a whole lifestyle approach, including vitamins.
Vitamin C was documented at the University of California in Los Angeles to actually extend lifespan, human lifespan, by 6 years by simply supplementing. By people who supplemented with vitamin C dramatically reduced their risk of coronary artery disease and achieved a 6-year increase in overall lifespan. Coenzyme Q10 is a nutrient introduced to this country by the Life Extension Foundation in 1983. It is the most effective nutrient available in treating cardiomyopathy, congestive heart failure, and of course coronary artery disease. And yet the FDA suppresses this information by denying the companies that market coenzyme Q10 the ability to disseminate the information to the public. So only people who bother to read health magazines and newsletters learn the truth about CoQ10, and that's the minority of Americans. The majority of them simply die from a CoQ10 deficiency when the life-saving nutrient is available right in a health food store.
And the RDA of about 60 milligrams a day for vitamin C and about 9 units a day now, they've reduced it again for vitamin E, may be enough to protect you from the classical deficiency diseases in most cases, but is far below what's best for optimum health. Not only that, you do not get the RDAs in a regular diet. In fact, the U.S. Department of Agriculture did a survey of some 37,000 Americans chosen to represent a cross-section of all Americans. 80% of them were deficient in one or more essential nutrients. For example, 80% were deficient in vitamin B6 alone. Now, if you're on a high-protein diet and not getting enough B6, that can result in rapid atherosclerosis. And it's interesting to note, 80% of the U.S. population is deficient, even by RDA standards, and atherosclerosis is the #1 killer.
What about 1,200 babies a year that are suffering from neural-tube defect that you guys want to allow a claim to be made?
We'll be right back with Senator Hatch and Mike Taylor after this.
In fact, there is considerable and mounting evidence that there's an inter-institutional, within FDA, substantial bias towards one point of view, that is a pharmacologic drug orientation point of view, and against other point of views, including food safety, and food supplementation. So I think that those who have studied FDA in depth have rather consistently come to the conclusion that FDA is not a fair regulator.
What you are about to see is no ordinary video. It is the last discovery of a man rated by many as the greatest living scientist this century. It contains a message he wanted you to hear in order to prevent the single greatest cause of premature death. Dr. Linus Pauling, the only scientist ever to have won 2 unshared Nobel Prizes, as well as 48 honorary doctorates, realized that the foundation of health depends on taking into the body the right molecules, the right food.
Sometime now, I have believed that it should be possible to get nearly complete control of cardiovascular disease, preventing cardiovascular disease from developing. The reason for my believing this is in considerable part theoretical rather than based upon clinical evidence. I remember that Einstein said that if he read about a surprising new experimental discovery that some physicists had made, he would not believe it unless there were a good, sound theoretical reason for expecting this phenomenon to occur. Well, in this case, about vitamin C in relation to cardiovascular disease, the arguments are quite straightforward.
You can't buy First Amendment aspirin from the Life Extension Foundation anymore because the FDA went to the manufacturer of this product and threatened to inspect them every single day unless they stopped making the product for us. They knew we weren't going to stop marketing it because we knew the truth and we knew we could document the truth in court. So the FDA illegally shut down the manufacturing of this particular product that we put together. It included, by the way, beta-carotene, vitamin E and vitamin C and B6. We put together a nice little package of nutrients in one pill, all fully documented to dramatically lower the risk of cardiovascular disease, specifically by inhibiting abnormal blood platelet aggregation that causes atherosclerosis and can cause a thrombotic heart attack or stroke. A lot of Americans will have died because the foundation didn't have a simple product to promote. It's easy enough just to put out an article and recommend low-dose aspirin, but it's hard to get people into the habit, especially when they're really only supposed to take about a quarter of an aspirin tablet a day, and people just aren't used to doing that. They don't perceive aspirin as a vitamin-like product like we perceive it as, in which it prevents a disease. So for the average person, they may buy a bottle of aspirin and may remember to take it, but unless they're continuously reminded, they forget. In fact, aspirin sales go up every time there's an article about its cardiovascular protective benefits, but then about 3 months later they level off to just where they were before. In other words, the public forgot. They're not taking it anymore. If the companies were able to advertise the fact, then the American public would take the low-dose aspirin and we'd save about 100,000 Americans every single year.
This isn't controversial. Aspirin is now widely recognized as a preventative.
Sure, if you're a doctor, you're probably on it yourself. However, if you happen to be poor and you don't read medical journals, you just drop dead of heart attacks.
You're not fans of the FDA, huh?
No, the FDA is inadvertently killing an awful lot of people by restricting information. The primary function of the FDA is to restrict information to people. We think that people have the right to hear the truth. For example, we think that the aspirin company should have been able to tell people about this aspirin study, which was funded by the National Institute of Health. Their tax-paying dollars paid for that study. They have a right to hear about it. The FDA isn't going to tell them about it, and if the aspirin manufacturers aren't allowed to tell them about it, what happens? People drop dead. Yes, absolutely. But the thing is, the genes provide you with protective enzymes of various sorts. If you didn't get a good genetic shuffle out of your deck, taking a supplement along with a little bit of aspirin can give you a much better chance.
Right, so just think of, most people don't get a chance to die of old age. Most people die of cancer and cardiovascular disease.
One or the other.
So if we can do something about them, Maybe we'll all get a chance to live to 110.
Right.
Hey, guys, it's only vitamins.
You may be wondering how the FDA can be so scientifically incorrect and economically incorrect and still maintain its power. Well, they do so at the point of a gun, just like the Gestapos did. They rule this country's healthcare system by rating companies that don't conform to the views of the FDA. The FDA on a regular basis investigates, stalks out people, doctors, scientists, organizations that are promoting advanced medical therapies to reduce the risk of contracting disease, to treat disease, to slow aging. They seize everything these companies own. They will incarcerate the owners if the activity continues. The FDA rules by force, not by scientific logic. Now, the Life Extension Foundation has been at war with the FDA since 1985, and we have seen every one of their actions. We have been raided at the point of a gun, and we sued the FDA, and we won. We won our attorney's fees back when they illegally held property owned by the Life Extension Foundation longer than what they were allowed to. We're suing them on a number of other issues. But the fact of the matter is, most organizations in this country aren't willing to take the risk of having their business shut down, having their bank accounts frozen, having their owners incarcerated. They simply comply with the FDA. No matter how wrong the FDA is on the scientific issue, the companies capitulate. And that capitulation results in Americans not gaining access to safe and effective therapies to prevent disease, to safe and effective drugs that could potentially cure certain diseases. We're suffering because of the FDA's Gestapo-like powers, and those are the powers that we would like to see abolished. If the FDA didn't have the police state behind them, backing them up, they would quickly dissolve because nobody would give them any credibility. Their only power is in the power of force, not in logic. And we would like to invite anyone who has viewed these tapes and seen this information to join the Life Extension Foundation to keep up to date with what we are doing to abolish the criminal activities of the Food and Drug Administration's criminal activities that are causing 1 million Americans to die every year and that are being maintained simply because the FDA has the force of the government behind it. We want to stop that, and we think we have the numbers to do it right now.
Alternative medicine physicians have never had the political power, and they may not ever have it.
It's a way of life. Yeah, it's a natural way of life.
Today, we must tell the drug companies to change those priorities.
It's God and nature against man and synthetics.
I don't really see it as a war. It's a communication problem.
He crafted the seamless logic of equality and was liberty's brightest light. But to many, he is just an icon, a distant part of an intangible past. He was the master spirit of democracy, an example to the world. Yet now, he is but a flickering flame in the consciousness of our young. Abraham Lincoln was indeed the fulfillment of the nation's democratic experiment. His life proof that even the humblest among us can have a voice against the powerful forces of injustice. True, his words have been veiled by the distance of time, but they are still our greatest hope.
Federal agents stormed an alternative medicine clinic with their guns drawn, catching workers and patients by surprise. The Tahoma Clinic in Kent has served more than 2,000 patients.
Well, I'm just absolutely shocked by what happened. This could well turn out to be the FDA's Rodney King scandal of 1992.
A grim specter has crept upon us.
Police department, open up! Open the door now!
The sword of government enforcement, which has been aimed at the alternative health community for years, has cut without warning.
It's our top story tonight.
On May 6, 1992, police in King County, Washington, under the direction of the Food and Drug Administration, kicked in the doors of Jonathan Wright's Tahoma Clinic as anxious patients and workers looked on.
Before I knew it, the door busted in, and there was an officer holding a gun pointed straight at us.
Said, everybody stand where you are, put your hands in the air, and don't move.
He ordered everybody to get up on the podium.
Get out here where we can see it. Get your hands up. Get them up right now.
We were just frozen. It was terrifying.
Terrifying as it might have been, it was the latest shot to be fired in the peaked battle between the Food and Drug Administration and alternative medicine.
They come in after 6 months of investigations, take 14 hours to strip his office, pull the phone jacks out of the wall so they can't make any phone contact with anyone, and then they say this is to protect the public.
A public firestorm engulfed the King County Police and the FDA, but it also shined a spotlight on the clandestine nature of the agency.
And the question is why? And that's a question tonight left unanswered.
3 days following the raid, FDA Commissioner David Kessler was forced to answer the same query on a viewer call-in show.
There was a raid. It was carried out a couple of days ago. There was one sheriff that did have a weapon drawn. It was standard operating procedure. And again, as law enforcement officers do, when you kick in a door, they had to protect themselves.
Unfortunately, amid the media barrage that resulted from the Wright raid, the human stories, the successes were mere footnotes.
Wright sees patients who have not been able to be helped by other doctors, so he doesn't see the easy cases. He sees the people who are at their wits' end.
They may try to stop us, but they'll never stop the demands that people have out there for asking for this kind of medical care.
And apparently she is right. In the past year alone, Americans made an astonishing 425 million visits to unconventional health care providers. But still, old thinking does not die easily. Dr. Warren Levin has been feeding the wrath of the New York State Medical Board since the early 1980s.
At that time, I got a subpoena asking that I turn over 3 charts for investigation. What's this all about? And they said, we don't have to tell you. We have given you a date to be here, and we expect you to be here with those charts. We have inquisitorial power in these matters.
After a legal fight that cost him tens of thousands of dollars because of medical politics.
And I will tell you that it's been a terribly, terribly devastating thing for me in terms of personal stress, in the stress on my marriage, and a major change in the quality of my practice of medicine. It has been a struggle.
Experience in New York is anything at all like the now infamous Arkansas State Board conduct. Dr. Levin may well lose his fight. There, a paternalistic system of backdoor deal-making allowed the State Medical Board unbelievable power to wield against anyone they chose.
They tried to put on the same level chelation therapy with some type of religious cult.
Is this the same group that promotes it, or does he belong to a different church?
Is the Arkansas Medical Board concerned about religion?
These attacks have left hundreds of devoted, caring, and well-trained men and women in their wake. And with every discussion of alternatives, it seems, comes the inevitable remark from conventional purists.
Quack, another word for fraud or fake. Thousands of quack medical products are advertising simple cures.
This ad campaign marked a momentous point in the government's relationship with the pharmaceutical industry.
All are a waste of money. Many endanger your health. So before buying a questionable cure, ask your doctor or pharmacist first, because the next dead duck could be you.
And a few years ago, they formed a group of people to stamp out quackery in the United States, and they funded that to the tune of $200 million. And that group of people have been systematically trying to influence the American public as to the harmful effects of vitamins and minerals and the lack of effectiveness of them in terms of treatment of different diseases.
Very often, we as consumers believe, oh, FDA approved, it must be okay. Johns Hopkins University reports 125,000 Americans die every year, not get sick, die, as a direct result of their doctor's prescription of pharmaceutical products.
On the other hand, supplements, nutritional supplements, are remarkably safe. There is less than one death every 10 or 15 years that is even marginally attributable to a nutritional supplement.
Do you know of any deaths coming from vitamin supplements?
I know of some illnesses.
I was aware of people who were overdosing on vitamin D and vitamin A at some point in time.
Doctors ought to be able to prescribe what they think works.
Main part of the Hippocratic Oath relative to us is first, do no harm, and for the good of the sick, to the utmost of my power. Nutrition to people first, rather than drugs first. And yet, the establishment wants you to use this cookbook approach to disease.
I have absolutely no doubt at all that this could be the medicine of the 21st century. Cost-effective, medically effective, what more can you ask?
The gratifying thing about working in this office and working with the alternative medicine community I've met so far is that they have universally have been enthusiastic about the opportunity to be able to test their modalities in a scientific way, to finally prove that what they do works.
They are the Galileos of our time, Renaissance doctors, who report that the earth is no longer flat. They too seek the conquest of disease and are working toward a healthier tomorrow.
What people who are really sick need are very well-coordinated teams of expertise, and that's what's missing right now, is there isn't enough teamwork.
Someone once said that truth passes through 3 stages. First, it is ridiculed. Second, it is violently opposed. And finally, it is accepted. So-called scientific truth is not necessarily the truth that benefits the people. It was scientists, after all, that spawned the notion that DDT was harmless, then virtually force-fed it to our children in public demonstrations to prove their point. And it certainly was not truth to our democratic ideals that spoke when dozens of poor black men were unwittingly chosen as guinea pigs in a scientific experiment about syphilis that lasted a half a century. Nor was it scientific truth that allowed a product called DES to be marketed as a prevention against miscarriage and premature labor, only to bring the heartbreak of disease and pain instead. So we should let truth, real truth, the truth of unanointed citizens scattered across our great land, to serve as our guide. They have no ulterior motives, no profit to be gained from their testimonies. They just own stock in the experiment of democracy. We should let their truth be the bias. It is what Mr. Lincoln would have wanted.
Preventing anti-aging research is another way the FDA causes a whole lot of Americans to die unnecessarily. Most people don't know it, but the FDA has to approve a human clinical trial involving any type of new substance, even something designed to slow down the basic rate of aging. And since the FDA refuses to recognize aging as a disease, despite overwhelming documentation that aging not only is the underlying disease that causes the degenerative diseases such as heart disease, cancer, Parkinson's disease, Alzheimer's disease, arthritis, the FDA says aging isn't a factor in these diseases, and we know that just isn't true. And the problem is the FDA does not allow human clinical trials on anti-aging substances, even though those substances are well documented in the peer-reviewed literature to slow the basic rate of aging. Aging is the process by which we die, and the FDA won't even recognize it as a disease. And that's why the Life Extension Foundation is documenting what can be done here to slow aging right now, and that if we simply looked at aging as a disease, which the FDA refuses to do, we could treat a lot of the incurable diseases that exist right now, and cancer is a real big one associated with aging that could be effectively treated by slowing the basic rate of aging.
The next medical cure-all, according to Newsweek magazine. A hormone that the body produces to help regulate our sleep and seasonal patterns, melatonin could reverse the aging process. Just about every disease of aging, according to studies, is caused by a melatonin deficiency, including cancer, cardiovascular disease, cataracts, Alzheimer's disease, Parkinson's disease, osteoporosis, and the overall decline in immune function that occurs with aging. Aging, according to studies, is caused in part by a melatonin deficiency that begins around the age of 40. Animal studies show that a nightly dose of this very inexpensive supplement can boost an immune system weakened by age, drugs, or stress. Melatonin may also prove useful, Newsweek reports, in preventing breast cancer, fighting existing malignancies, and slowing the growth of human tumors. The man who has been preaching this gospel of melatonin for years will join me to celebrate the coming out for what could be a miracle of nature. This is the magazine you put out, and I plagiarized most of my articles on science from this, but I just learned from you that you get your information from this book.
For melatonin, we've gotten a lot of good information from a book published by the New York Academy of Sciences. That's a 588-page, very technical book about the multiple benefits of melatonin. Now, we read that book several times, condensed it down into lay language so people who read our magazine can understand how to use melatonin to prevent disease, slow aging, and get a good night's sleep.
All right. Now, Newsweek magazine has confirmed your existence. Newsweek magazine has confirmed the theories that you have been saying for years. There is a little bit of history I think that the public ought to have. You've been touting melatonin, the usage of melatonin, for how long now?
We've been doing it for about 10 years, though we didn't have access to it until 1992. And we started selling it in 1992, despite the fact everyone told us we were going to get arrested and put in jail for doing it. The FDA, of course, has not approved of it. Right now, melatonin should be available in every health food store in the country because of all the favorable publicity. Melatonin is not approved by the FDA. It is a natural hormone. People should understand that. This is not a drug. It is a natural hormone, and around the age of 40, we don't produce very much of this natural hormone anymore called melatonin.
You're not prescribing medicine. You're not practicing medicine. What you're saying is based on studies?
I'm citing over 4,000 published studies that have been done on melatonin, showing it to be the single most effective anti-aging agent in the world.
If you know all of this, the FDA's job is to know what you know, hopefully plus more, because if the FDA is informed, then they protect the public and so forth. Why is it the FDA will not approve melatonin?
Well,
or has not, rather, approved melatonin?
Our opinion is the FDA doesn't know anything at all about it. When people call them up, they don't seem to have any evidence that they've looked into it at all. They don't seem to care that anybody's selling it right now either. Now, when we started selling it in 1992, we were told they're going to take us away in handcuffs and throw us in jail, that we couldn't just sell something like that that's not approved by the FDA. I've had to stare down the barrel of a .45 caliber handgun. I've had FDA agents armed break down my doors, seize my vitamins. They don't like what I have to say. But what I said back in 1985 in our newsletter about using vitamins to slow the progression of AIDS now is acknowledged by the FDA as being true.
No, wait a minute now. You said that vitamins
slow the progression of AIDS in 1985. Now, in 1985, in our newsletter, Anti-Aging News, that taking vitamins will slow the progression of AIDS. The FDA used that newsletter to get a search warrant and seize all of our vitamins because they didn't want AIDS patients taking them. In the April 1995 issue of FDA Consumer, the FDA now is recommending that HIV-positive people take vitamin supplements to slow the progression of the disease.
So wait, no, is your crime that you're ahead of the FDA?
Our crime
is that the crime you have committed?
That is the crime we've committed. We are 10 years ahead of the FDA on the AIDS vitamin issue, and on melatonin, who knows when they're going to be able to figure out what it is.
There's a drug war going on you might not be aware of. A battle between the Food and Drug Administration and some people who think that agency is holding back on life-saving medication. As Health Watch reporter Dr. Steve Greenberg explains, the battleground is a new museum located in a Broward storefront.
My name is Bill Falloon. I am the Vice President of the Life Extension Foundation. We're going to talk about drugs today. Drugs that the Food and Drug Administration is denying to American citizens. We have just a few of these drugs sitting right in front of me. These are drugs that save human lives, but that the FDA does not allow Americans to access. Because Americans cannot access these medications, they are suffering and dying from diseases that already have effective treatments markets in other countries. These drugs are sold in other countries. They're actually approved by the health ministries of Europe and Japan, and the European and Japanese are able to gain access to these advanced therapies while Americans suffer and die. The Life Extension Foundation started in 1980, and when we discovered the value of these drugs, we started to promote them, and we continue to promote them. We hope you enjoyed this show today because we're going to enlighten you to facts that you had no idea existed regarding how the Food and Drug Administration, that's the FDA, is denying American citizens life-saving medications. Most Americans don't realize how long it takes for FDA policies to come into effect that enable new drugs to be approved. The FDA is so slow at approving new drugs that Europeans gain access to advanced therapies on average of 2 to 5 years sooner than Americans. Now, the effect of that is that American citizens are dying while Europeans are using proven medications to save their life. Now, one example of this is the beta-blocking drug called Enderol. Now, Enderol is approved in the United States, and statistics show that beta-blocking drugs, of which Enderol fits into that classification, save about 300,000 American lives every single year. Now, the problem is, while the FDA has approved Enderol, it was approved in Europe 9 years earlier. Now, we're looking at 300,000 American lives being saved by this one class of drug only. Americans had to wait 9 years to gain access to this drug. You multiply the 9 years times the 300,000 Americans' lives that can be saved every year, that's 2.7 million dead Americans from the FDA's deprivation of just one drug. One drug the FDA delayed in approving caused 2.7 Americans to die unnecessarily. We're going to talk today about a wide range of drugs that the FDA is denying to American citizens. And we're going to document how the FDA's failure to approve these medications is causing over 1 million Americans to die every single year in the United States. The first drug we're going to talk about was actually discovered in the United States. It's a broad-spectrum antiviral drug called ribavirin. Now, the name on this box reflects a brand name of ribavirin sold in Mexico. It's made in the United States, sold in Mexico, sold in Europe, sold in Japan. It's sold all over the world because it works. It's documented in a couple thousand studies to be a broad-spectrum antiviral drug. It can cure a common flu within a couple days, whereas if you don't have this drug, you might suffer for a couple weeks. In elderly people who suffer from influenza, which can be life-threatening, ribavirin often suppresses that virus within 48 hours. Now, one of the most common uses that ribavirin is employed for is hepatitis C. The FDA-approved drug called interferon only affects about 20% of the hepatitis C patients in a positive way. That means only 20% of the hepatitis C patients receiving alpha interferon get a remission effect. Now, if you combine the ribavirin with the interferon, you can improve that effectiveness rate by up to 10-fold. 10 times more hepatitis C patients benefit when the unapproved drug ribavirin is combined with the FDA-approved drug alpha interferon. The drug vinpocetin, sold in Europe under the trade name Cavinton, is used to treat diseases related to neurological aging. Elderly Americans are suffering an epidemic of diseases related to neurological aging, premature senility, Alzheimer's disease, stroke, Parkinson's. The drug vinpocetin has been used in Europe for about 12 years to enhance cerebral oxygenation. As people grow older, they lose the blood flow to the brain that they had when they were younger. Europeans are using drugs that help maintain and restore cerebral circulation. There's also some other benefits to taking a drug like vinpocetine. Brain cells lose their ability to produce energy as they grow older. Vinpocetine enhances the energy-producing capacity of neurons. Those are brain cells that lose their ability to function in a youthful state, but by taking a drug like vinpocetine, you can help restore older brain cells to a level in which they function as a younger person rather than an older person, thereby improving short-term memory and overall cognitive function. This drug was published in the United States in 1986, 1987 as something was going to be the next breakthrough therapy for Alzheimer's disease, and they thought it might get approved very soon. Well, the fact of the matter is it has not been approved. You can buy this drug in Europe, can't get it in the United States. Older Americans are losing their neurological capacity in the United States government, and the FDA are denying this drug to American citizens.
The brain is the control center of all forms of physical and intellectual activity in the body. 10 billion different cells with millions upon millions of neurons, forming connections several hundred times more numerous than the world population. At the age of 30, cell units die and are never again replaced. Thus begins an inexorable process, and one which becomes more and more acute in older people. Today, however, the joint forces of research, biotechnology, and fine chemistry allow us to fight against such relentless deterioration. Now we know not only that cell death is not inevitable, but also that we can develop and increase our intelligence. And here is where vinpocetine comes in. Vinpocetine is an oxygenator and an activator of the brain's metabolism. As a result, it acts as a powerful memory enhancer. The substance's active principle, vinpocetine, acts both on the circulatory system and on the brain's metabolism. The combination of vinpocetine's own proven effects, the fact that it does not interact with other substances, along with its absolute levels of tolerance, have led to worldwide expansion. This continued expansion is protected by over 100 patents and product registrations, brand names, trademarks, and designs in virtually every country in the world. $600 million tablets, manufactured over the past 5 years and sold in 15 countries around the world, serve as proof that vinpocetine's advantageous effects and tolerance levels are beyond all doubt. There have been numerous studies conducted on healthy volunteers to evaluate memory improvements in the short and in the long term. As regards product tolerance and interaction with other substances, vinpocetine is practically non-toxic, which allows for long-term intake at zero intolerance levels. Vinpocetine is a product derived from applying fine chemistry's state-of-the-art technologies to natural plant extracts.
The next medication we're going to talk about deals with the immune system. As people get older, their immune systems decline. They become much more vulnerable to cancer and infectious diseases. There's a drug that was discovered in the United States called isoprenosine. This drug has been documented in over 1,000 studies to be effective in enhancing immune function. The FDA does not allow this drug to be sold in the United States, but it's sold in every other country in the world. The New England Journal of Medicine has published articles showing that the use of this drug will slow the progression of HIV infection. There are several studies in Europe showing that cancer patients can go into a remission if they take this drug. It enhances the immune system's attack against cancer cells. Now, as people get older, their thymus gland does not produce the amount of hormones necessary to maintain immune synchronization. Isoprenosine works by substituting for the thymic hormones and maintaining youthful immune synchronization.
elderly people could benefit immensely by taking isopronosine several times a year to maintain their immune system. Trouble is, the FDA doesn't allow this very inexpensive, semi-natural therapy, by the way. You can actually get this in a health food store in a different form. It's not the exact same thing, but it is a natural amino acid. But most people don't know that. And as a result, Americans are not benefiting from this natural immune boosting therapy that the FDA has suppressed for over 12 years. We're back talking about medicines that can save American lives that are being denied by the FDA. Now, a medicine that a lot of Europeans buy over the counter that you can't get in this country is called centrophenoxine, sold under the trade name Lucidril. Lucidril does a real interesting thing to older brain cells. As brain cells age, they accumulate a cellular debris compound called lipofuscin. You can actually see this in autopsy slides of elderly people. The lipofuscin clogs up the brain cell's machinery, it doesn't function very well, and eventually people develop senility, memory loss, cognitive deficits, and some of them have to be institutionalized because of lipofuscin accumulation. Now, a drug that's been shown to remove cellular lipofuscin debris in aged cells, centrophenoxine, has been used in Europe for about 30 years. It's very inexpensive. You can buy it over the counter. If you go to a doctor in Europe with memory problems, he'll just suggest you go down to your pharmacy and buy some of the centrophenoxine, and that will probably help out quite a bit. Some animal studies have shown that if you give the animals centrophenoxine, it actually extends their lifespan, and that makes a lot of sense. If you clog up your cells with enough debris, they're not going to function very well, and as a result, you will die prematurely. Americans cannot buy centrophenoxine, even though it costs virtually nothing. It's extremely inexpensive, but we're not allowed to have it. Instead, we face being institutionalized in nursing homes. We face being exposed to FDA-approved drugs that don't work very well, that cost lots and lots of money. So we'd like to change the system a little bit. We'd like Americans to be able to gain access to medicines that are approved by health ministries in other countries. Europeans aren't dying from as many drug interactions as Americans are, and that's because Europeans rely on scientific studies to document drug safety and efficacy. FDA relies on politics. A big difference, and we're going to change that. So please listen to what we have to say about additional drugs that the FDA is keeping out of the hands of Americans. But what we'd like to address right now is how much does FDA protection cost us? Now, there's a drug used to slow the progression of Parkinson's disease called Deprenyl. Now, Deprenyl was used in Europe. This is how it's sold in Europe under the trade name Jumex. The name of the drug is Deprenyl. It was sold in Europe in the 1970s, and Europeans used it as an effective therapy to slow the progression of Parkinson's disease. Now, Deprenyl in Europe cost about 50 cents a tablet. And of course, they had access to it back in the late 1970s. Well, in 1989, the FDA finally got around to approving an American version of Deprenyl, and that's called Eldepril. Now, Eldepril cost about $2.25 a tablet, compared to the 50-cent a tablet price in Europe. Now, to buy 100 tablets of the American Deprenyl product that the FDA took over 12 years to approve, this cost you about $225, as opposed to $50 for 100 tablets of the European version. So the FDA's protection has caused the price of the American version of the identical drug to be more than 4 times greater than what you can buy it for in Europe. So what we pay for in the United States when it comes to FDA protection are outrageous drug
prices. Pharmaceuticals cost more in the United States than any other country in the world. People who live along the border of San Diego and Tijuana will often drive across to buy their medications because they cost a lot less money. FDA protection means high prices. The American consumer is being defrauded by the FDA's so-called protection because what we're doing is paying 4 times more for the identical medication because the FDA causes pharmaceutical companies to spend so much money performing unnecessary tests. Remember, these drugs were approved in Europe already by health ministries. Unfortunately, the FDA does not recognize research done in other countries, so they make pharmaceutical companies in the United States repeat the same research, and Americans pay. We pay because we pay too much for our drugs to compensate the pharmaceutical companies for the unnecessary clinical studies the FDA forced them to do.
The FDA denies American access to life extension and life-saving therapies, and some of these therapies are as simple as reducing the cholesterol content of your diet. In 1959, we have documented right here from the Federal Register, in 1959, the FDA made it illegal for a food company to promote low-fat, low-cholesterol foods as a way of reducing their risk of heart disease. Ads such as this that were being run in which they stated in the ad that reducing your saturated fat intake and reducing your cholesterol intake could possibly reduce your risk of coronary artery disease were banned. The FDA, in some cases, raided cereal companies and seized their cereal boxes if they implied that a high-fiber, low-fat diet could reduce the risk of coronary artery disease. Now, the FDA was wrong in 1959, and they carried their ignorance all the way up until about 1970 before acknowledging the role that fat and cholesterol play in the development of atherosclerosis. Now, fortunately, we've got this documentation here on the Federal Register, so we can show historically that the FDA has been wrong, dead wrong, in restricting Americans' access to even simple therapies like high-fiber, low-fat foods. Most people don't know that the FDA regulates the water that you drink, and what the FDA tells you is that tap water is safe. The fact of the matter is tap water is very dangerous to drink on a lifelong basis. Studies have shown that people who drink tap water have 50% increases in their risk of rectal and bladder cancer. Other studies show increased rates of cancer among tap water consumers of various sites of the body. Tap water should be avoided at all costs. Now, when the first company came out with bottled water back in the 1930s, the FDA said that it was fraudulent to imply that drinking bottled water that was free of the industrial carcinogens contained in tap water was safer. The FDA spent 22 years litigating against the Capon Springs Bottled Water Company because they kept insisting that their bottled water was safer than tap water. The fact of the matter is tap water contains many known cancer-causing agents in levels far in excess of what even the government says is safe. And people should avoid drinking tap water at all costs. The foundation recommends that people use a good water filtration system or buy their water from a reliable bottled water supplier because tap water causes cancer. The FDA still denies it, but the facts are that the studies show tap water is extremely carcinogenic and should be avoided at all costs.
Tell us a little as to what has changed in our environment in the last, say, 60 years.
Well, food has gotten real cheap in today's world. It makes up the smallest percentage of our net financial expenditure in all of history. The drawback of that is the farmers are using a lot of little devices, a lot of little chemicals to make food production so efficient that it's killing us. We're eating pesticides and herbicides. We're consuming a lot of contaminants that are causing the cancer epidemic
that is spreading across the Western world, the United States, Northern Europe, Japan. They're dying of cancer in record-breaking amounts, statistically speaking. And a lot of that has to do with environmental pollutants. In the food we eat, be it the vegetables, be it the meats, they're there. The only thing we can do is take nutrients that can mitigate some of the carcinogenicity of those pollutants.
We have 85 stores in Northern California, Northern Nevada. Produce is a big thing for us. You can see from the store.
Charles Collings is president of Raley's Supermarkets, and like most grocers this time of year, used to going far and wide to get fruits and vegetables to satisfy his picky customers.
Bananas and things of that type are all imported. We fly in pineapple. The growing season in California has ended, so we're bringing in all the vegetables from Mexico.
But a few years ago, Collings started going someplace really odd to satisfy his customers, to a laboratory and a company called NutriClean, run by Stan Rhodes.
Raley's called us in 1987 because the National Academy of Science published a report that said that there were certain types of pesticides in our food that could cause harm to the population.
So Raley's hired NutriClean to screen its produce for pesticides, to catch what the government doesn't.
We find 60 to 65% of all the produce we test has residues. The current system is set not for public safety.
Nogales, Arizona, one of the Food and Drug Administration's, the FDA's, many checkpoints. Hundreds of trucks pass through here each day.
Every conveyance that you see at this facility arrives today and it leaves today.
Customs checks for drugs, agriculture checks for insects. The FDA checks for pesticides.
No, I don't think they're in.
Well, not today.
The FDA office in Nogales, Arizona on Wednesday is closed.
The Food and Drug Administration can't be everywhere all the time. And if you want to be a critic, you can take a number because we have plenty of those.
John Jones of the Food and Drug Administration admits the FDA checks only 1% of all imported produce shipments. But he says that's enough.
We know that a lot of the pesticides coming in on imported food are known to cause cancer and reproductive effects in animals. Many of them are presumed to cause cancer in humans.
Pesticide expert Richard Wiles worked on the 1993 National Research Council report, which warned of unsafe pesticide levels in America's food.
High DDT residues.
Unsafe especially for kids.
We tell you that the food supply is safe because half the pesticides that are used to produce food can't be detected. When the pesticide is made in Hungary or Czechoslovakia or China and then imported into the United States on pineapples, those companies are under no obligation to tell the FDA how to find that pesticide. There's no way they're going to find that pesticide.
When we have tested the same food that the government has tested, we have found 6 times more residues.
This is where the fruit and vegetables are stored.
We have seen products from Eastern Europe, particularly, that had the scariest pesticides I've ever seen in my life.
There we go.
Pesticides that would never be used on food in the Western world.
The cucumbers will be the last item that I will pick up here.
The FDA wouldn't have picked that up?
I don't know if they picked it up. We found it.
48 Hours is about to put the Cunningham's fruits and vegetables to the test.
Jeez, don't really look that good.
We took the produce the Cunninghams and 3 other families bought
That one looks okay.
and analyzed it in a lab. The idea was to see if children are being exposed to dangerous levels of pesticides.
So who has faith in the federal government to look out for your best interests and your children's best interests as far as your health information?
We're at the bottom of the food chain. I have no confidence that these numbers they pick out have anything to do with our health. I think it has to do with...
What did the test results show? What did they prove?
90% of the samples tested were positive for pesticide residues.
Oh, wait a minute. And you're saying 90%
of the products that we tested for the 4 families showed residues of pesticide?
That's right.
Who purchased more?
Cunningham's are clearly number one. They had over 20 different pesticides in this market basket of fruits and vegetables that they purchased. They had the grapes with 6 different pesticides and apples with 5 different pesticides, oranges with 3, including this orthophenylphenol compound, which is the active ingredient in Lysol, which we think is a chemical that should be removed from the market.
They had a chemical on the orange that was used to make Lysol?
They purchased potatoes that had by far the highest residues of any food purchased by any of the families, 15 times higher than anything else we found. It's a chemical called chloropropam.
While the levels of chloropropam are substantially reduced if the potato is peeled, the EPA has not determined if it has health risks.
If there's anything you can do besides complain about pesticides, here's the news. What most of us think works doesn't. Rinsing fruits and vegetables underwater doesn't do much of anything at all, except make them wet. Experts say that's because pesticides are made with what are called stickers and binders during a rinse in the sink. Using a scrub brush and a mild detergent like dishwashing liquid can remove a lot of pesticides, but not if your produce is coated in wax.
This is the first time I hear.
This is waxed mainly to seal in moisture.
It's very difficult to come off.
And in the process, pesticides are also sealed in. Wax is obvious. This red delicious apple looks as though it's been Simonized, but sometimes it's not so obvious.
Some of the eggplants are. I don't know what else, really.
Other produce that may be waxed? Peppers, oranges, pears, zucchini, even tomatoes. It's here at the packing plant that tomatoes get brushed with a very thin coat of wax. As of last week, supermarkets nationwide were required to post signs telling you which items are coated with wax. What those signs won't tell you is which items are coated with a wax mixed with a pesticide. To find that out, you have to go where shoppers usually aren't allowed. Back here, where the produce is stored. It's hard to spot, but the label on the shipping carton will tell you not only if wax is used, but what's in the wax, including chemicals like O-phenylphenol, the ingredient in Lysol, that the EPA says probably causes cancer if ingested in large enough quantities.
I really don't know what's in the wax.
Get the peel off, because experts say O-phenylphenol doesn't penetrate.
Ladies and gentlemen, health, vitality, and energy.
The only way to avoid all pesticides is by buying produce that's grown organically.
Sweet organic strawberries.
Free of all synthetic chemicals.
Customers.
So we don't even really know how much exposure children have now.
No, we don't. We truly don't.
And those who have experienced the most extreme pesticide exposure feel a sense of urgency to get the answers.
It's common sense. We've got to wake up. We've all got to wake up, because if we're dying, you're not escaping from it either. Your children's children. We got to find a safe place. And the way to start is we got to get our government to be accountable to what they're registering out there and what they're permitting, what pesticides they're permitting. Study them. And it causes cancer or defects. Stop it.
If you have 600 active ingredients that are out there being used in commerce in large quantities, and you haven't tested but a small subset of them, that means you're using the population as experimental animals for the ones you haven't tested. By definition, you're doing that. So that's not good public policy.
But public policy on agricultural chemicals has gotten bogged down in the minutiae of bureaucracy and the politics of pesticides. Caution and delay control the agenda.
It's outrageous. Every year that it goes on without resolution is it's a travesty. We're eating that stuff.
Well, This is one of the least crowded hearing rooms on Capitol Hill. Here is where they discuss alternative approaches to farming. The Senate Subcommittee on Agricultural Research, chaired by South Dakota Senator Tom Daschle. There are rarely chemical lobbyists in this room.
I hope that today's discussion will generate some good ideas about how...
Less than 7% of the USDA's research budget goes towards promoting alternatives to chemical agriculture.
The federal government now admits it has failed to adequately protect children from potentially dangerous pesticide residues. Consumers, you and I are part of the problem, demanding the cosmetically perfect fruits and vegetables that chemicals produce. Did you know that many of the chemicals used have nothing to do with protecting crops? They merely make fruit bigger, shinier, more pleasing to the eye. Now admit it, you'd have picked this one too. And we prefer convenient foods, seedless creations, easy to eat.
When we bred the seeds out of watermelon, we got a poor watermelon. When we bred the seeds out of grapes, we got weaker grapes. We've got a grape that was developed by the USDA. I mean, that grape was just meant to rot. But you've got to spray it every 5 days, every row through the entire harvest season to get it to market. And the only way around that is to spray it with fungicides that are systemic, meaning that it goes into the fruit itself. It's seedless and it's red, and that's what the customer wants.
This past spring, the National Academy of Sciences issued an important report that showed that by the age of 5, the average child in America has consumed pesticide residues above the lifetime allowable amount, according to the Environmental Protection Agency, for not 1 or 2, but often 5 to 10 pesticides from the residues in the food. When Commissioner Kessler was asked about what FDA was going to do about this important, compelling public health food safety question, he came forward and said that FDA would urge the industries to develop safer pesticides. When we look at the relative risk of supplements, where FDA is putting considerable effort and considerable resources to extend regulation and reduce availability, and we compare that with the risk of cancer promotion or the other immunologic deficiencies that can result from accumulation of pesticide residues in the body, there's a clear discrepancy between a compelling public health need for safer food and the way in which FDA is putting resources towards reducing availability of supplements. And it's ironic because in many cases the supplements may reduce the toxic effects or help detoxify the pesticide residues.
Americans expect the Food and Drug Administration to protect them against dangerous drugs, to protect them against fraudulent health claims, to protect the blood supply and even the water. Now, we've shown that the FDA has not been doing that, but an area that's of acute need of protection is our blood supply. When we get a blood transfusion, we want to know that every single test was done to ensure that we're not transfused with HIV-tainted blood, with hepatitis, with a number of different diseases, and yet when you look at the facts, the FDA has utterly failed to protect the nation's blood supply. They allowed the blood banks to sell HIV-contaminated blood even after they had a test to determine if the blood was HIV positive. They simply didn't require the blood banks to do the testing for a number of years. And this is well documented in newspaper articles and books that the FDA wasn't convinced that HIV was even a transmissible disease via blood transfusions. The FDA, again, is wrong on the scientific issues, and yet they did nothing to correct the problem until enough people contracted AIDS and, of course, hepatitis through the blood supply to make the FDA pay attention. And even at this time, there are blood banks who are not following through on the medical procedures, and the FDA is ignoring the problem. One of the reasons this happens, by the way, is like with the pharmaceutical companies. When people in the FDA leave their positions, they go to work for these drug companies and make a lot of money. Well, FDA officials also go to work for the Red Cross and other blood banks, and they make a lot of money as ex-FDA officials, as advisors, consultants, board members, etc. So the FDA caters to the economic interests of the industries it regulates more so than it does to protect the health of the American public. And we believe the blood banking scandal, and we're talking about 30,000 hemophiliacs who have contracted AIDS because of the FDA's failure to properly monitor the blood bank's activities. That is an absolute criminal action. Other countries have incarcerated officials responsible for that. We believe the time will come when FDA officials will be incarcerated, along with blood banking officials who failed to recognize the risk and intentionally inflicted AIDS-tainted blood onto innocent victims.
Last month, there was panic in Germany when the government filed criminal charges against a blood products company for distributing blood contaminated with the AIDS virus. But it was too late for Hans-Dieter Hahn, who contracted the disease from a transfusion. He says it's a catastrophe, and people like him have been handed a death certificate. Tonight on Frontline, the decade-long story of how the AIDS virus entered this country's blood supply.
No one in government accepted the responsibility of saying, hey, we've got to do something about this.
Frontline investigates why warnings were ignored by regulators, blood banks, and doctors.
Nobody had the decency to tell us.
To tell us there was any risks involved.
You know, it's my child.
Tonight, AIDS, blood, and politics.
Ask what type of relationship exists between FDA and State Departments of...
This summer, in a congressional hearing room in Washington, the Federal Food and Drug Administration sounded a warning about the nation's blood supply.
This industry is not assuming adequate responsibility for putting in place and then following the basic quality assurance programs required to assure the safety of the blood supply.
As head of the FDA, Dr. David Kessler is responsible for blood safety.
These were system-wide problems that were not being addressed at the national level of the American Red Cross.
In September of this year, a lawsuit was filed against blood product companies on behalf of 10,000 hemophiliacs who were infected with the AIDS virus through the blood supply.
It's been lied, and it's gonna come out, hopefully with a congressional hearing, it's gonna come out. And I hope the world knows the truth before I die, because I'll tell you, I've got an appointment soon to die.
It is now estimated that as many as 30,000 Americans were infected with AIDS through blood. It's a tragedy that has exposed critical weaknesses in the rules and practices of blood banking. It's also a story of missed opportunities, vested interests, and lax regulation, stretching back more than a decade to when a mysterious virus entered America's bloodstream. Blood banks were used to doing things their own way. They had even persuaded the FDA to reduce the number of inspections of blood banks. Gilbert Gall is a reporter for the Philadelphia Inquirer.
I stumbled upon a document in which the blood banks were talking about how they had successfully lobbied the regulators to reduce the number of inspections to one every 2 years as opposed to one every year.
Investigating safety in the blood supply, Gall found that the FDA reduced the number of inspections at the very time the AIDS virus was entering the system.
Even if you accept the idea that, well, we didn't know in '83 that AIDS was in the blood supply. I mean, we sure as hell knew that it was in the blood supply a year later. And why wouldn't you have gone back at that point in time and increased your inspections so that you could police bad blood getting out the door? But they didn't do it. I mean, that didn't come until 1988 when all of a sudden everything exploded and the blood banks started having all these horrendous problems and all these recalls.
Gall discovered FDA reports of errors and accidents. That between 1985 and 1987, thousands of units of potentially contaminated blood had been released and then officially recalled.
Recalling blood that has been released for transfusion is a bit misleading because depending on when and how you're trying to recall it, the chances of your being able to get it all back are almost zero. Because once it's released, it's used.
12 million units are donated every year.
And so when asked, Dr. Kessler has to guess how many cases there are annually.
That translates into somewhere between 90 and 450, 460 cases, if my memory serves me correct.
For Gilbert Gall, who won a Pulitzer in 1990 for his reporting, it sounds like an old story.
The numbers were suspect. To some extent, they're still suspect. I don't have a whole lot of faith in them. Flipping it, that's not to say that the blood supply is just incredibly unsafe and just full of AIDS. I mean, nobody's saying that. Nobody's even suggesting that. But God, I mean, we ought to have at least better data, and we ought to have the top public officials in this country, speaking honestly with the American public.
Anybody from the FDA ever show up here to inspect?
Not in this center, to my knowledge.
I mean, I just don't know it.
Well, we were just kind of astounded.
We asked Dr. Kessler about the letter and why, after all its problems, the FDA hadn't been back to re-inspect the Portland Blood Bank.
There have been, there are real problems. We have seen violations throughout this industry, and that's the reason why we went to an injunction. I mean, it was
But even back to Portland to do a full inspection in 2 years and 4 months is my question. And on what grounds are they performing this test? I'd like to get an answer because...
When was the last Portland inspection?
Well, I can't tell you the specifics of each and every inspection that's been conducted at Portland, and some of the issues there are unresolved issues that I'd prefer not to address.
I mean, what chances are, when was the last time Portland was inspected?
Soon after this interview, in July 1993, FDA inspectors went to Portland for the first full inspection in over 2 years. The inspection cited 35 violations during the month of January 1993, including failure to properly perform the ELISA test.
Of blood transfusions are safe, and nothing of what follows should cause you to reject blood if you face a medical emergency.
Tonight, the results of a 6-month Dateline investigation, and for the first time on television, we'll show you the scope of what the Food and Drug Administration described as a continuing pattern of violations. Violations that call into question whether the blood supply is as safe as it can be.
I was just totally shocked, stunned. I couldn't say a word, I couldn't think, I couldn't do anything. AIDS was the last thing on the face of this earth that I was worried about. Near as clear a day as it could be.
Far removed from the urban neighborhoods that have become the killing grounds of the AIDS epidemic.
It's hard to imagine anybody being much further from the high-risk groups for HIV infection than you.
Right, that's what we thought. Absolutely.
Well, apparently our high risk was accepting blood from the blood bank.
Through a blood transfusion, a transfusion he received more than 4 years after the government had approved a new test that was supposed to screen blood for AIDS. In the early years of the AIDS epidemic, before scientists knew much about it, thousands of people contracted AIDS from blood transfusions, including celebrities like tennis star Arthur Ashe. Jones says his case is evidence that the risks are greater than most people realize. And as you'll see, our own investigation points to the same disturbing conclusion. How can contaminated blood get through the screening process? And is it still happening today? We started asking those questions. We found a blood safety net, which government officials say has potentially dangerous holes. From big city blood banks, where government records show some critical testing and labeling violations going on year after year, right to government computer files that document blood recalls, something we've never heard of, hundreds of them nationwide. And finally, to the headquarters of an organization responsible for nearly half of the nation's blood supply, whose record of repeated safety violations recently landed it in federal court.
Still not scare the public.
But even if every step in the AIDS test is followed to the letter, contaminated blood still can slip through because the test has an inherent weakness, something blood banks know, but you may have heard little about. The problem is that the test doesn't actually look for the AIDS virus itself, but for the immune system's response to it, the antibodies.
And once a person is infected with the virus, it takes time for the antibodies to form. It may take a few weeks, it may take 4 or 5 months.
If a donor is recently infected, it may not show up.
That's correct.
That means the test has a built-in blind spot. And since each unit of blood usually is split into different components, each component going to a different patient, one bad unit could infect several people.
We just heard there is a blind spot in the test used to screen blood for the AIDS virus, making it inevitable that blood from some recently infected donors will slip through. That's a problem both for Red Cross blood banks and for private ones as well. But the question is, given that, how should blood banks respond once they've learned that one of their donors has tested positive for the virus? What responsibilities do they have to notify patients who may have received tainted blood? As we discovered, that's another problem area for the FDA. An AIDS transfusion case reported in October of 1991. The blood donor isn't contacted until February of 92, and as of May 92, more than 6 months later, the blood recipients hadn't been contacted.
I think that's criminal. I think it's absolutely irresponsible, because not only do you have the blood donor who hasn't been contacted immediately, now you have the recipients who are infected and capable of infecting other people.